Hi, I'm Cameron Mitchell, Health Director for the Wasatch County Health Department. On behalf of the Wasatch County Board of Health and staff, I'm pleased to bring you our 2012 annual report. It is my hope and intent that the information shared in this report adequately illustrates the resources and efforts invested to help protect the health and safety of individuals, families, and environment in this wonderful community. The stories and examples shared in this annual report represent just a small portion of the many activities, events, and partnerships the Health Department participates with each year. These activities and partnerships make Wasatch County a safe and healthy place to live. I know that I speak not only for myself, but also the board and staff when I say thank you for entrusting us with the responsibility and opportunity of providing Wasatch County with the very best public health services possible.
One of the most important things we do here at the County Health Department is link people to community resources. I recently saw a patient who had neglected her health for several years. She lost her health insurance and was unable to afford to see a physician. She was living in the Prestige Living Center, which was built by our housing authority here in Wasatch County. And there at her housing complex, the Applegate Home Health Care Company offered a free health screening. She attended the health screening, and the nurse there noted that she had elevated blood pressure and blood sugar. And she referred her to our Wise Woman program here at the County Health Department. We were excited to receive that referral, and we were able to do a more thorough screening for this patient. We were able to look at her blood pressure, blood sugar, blood cholesterol, among other lab values, and we were able to screen her for cervical cancer and breast cancer. Through that exam and evaluation, we discovered that this patient had hypertension, hyperlipidemia, and type 2 diabetes. She was unaware that she had any of those conditions. The Wise Woman program was able to refer her to a physician and pay for one appointment for him to confirm our diagnoses and begin her on medication to treat those conditions. Her condition rapidly improved with treatment, but unfortunately, we are unable here at the Health Department to provide continued care for a patient with diabetes. So I referred her to the People's Health Clinic in Park City that treats uninsured residents of Wasatch and Summit counties, and she received continued care there. We were excited to have her referred to our program, and we're excited to be able to refer her to other resources in the community that will help her live an active, healthy life.
A major role of the health department and of public health is to educate people about how to be healthy and about how to be safe. And one of our programs that we use to do that is our Governing Youth Council. GYC is a youth service organization that helps teach their peers about being safe and healthy. And so they plan activities all throughout the school year. They also receive some training themselves so that they can be effective teachers, and then they take those messages out to their peers in the schools and teach them to them. With GYC in this past school year, we did some really fun activities. So one of our funnest ones was the Texting Dead Day, where we got 10 body bags from our local EMS, and we stuffed them with newspapers and displayed them out in the middle of the commons area of the high school, along with stories of Utah youth who had died from driving accidents. And so the students throughout the day could walk around and look at those, and it made a really big impact on youth. We're always looking for new and creative ways to try and educate the community and reach out to them. And so GYC has been one of the funnest ways that we use to educate youth in our community, and that's a really important thing. There's a lot of important messages that we want to get out to teenagers, but they don't always want to listen to adults telling them what to do. And so when we've had popular kids in the school who are part of GYC out giving those messages to their peers, and then that's been really effective. And it's been a great opportunity to the youth as well who have been involved in GYC they've gained some experience and learned some important information about tobacco prevention and teen safety as well. So it's been a win-win partnership.
In the epidemiology program, we investigate diseases to find their source and then to try to prevent their spread. In 2012, pertussis, also known as whooping cough, caused us a lot of concern because we saw a sharp increase in the number of cases throughout Utah. This disease is usually not very severe, fairly mild in otherwise healthy adults, but it can be deadly in infants and others who have weak immune systems. Here in Wasatch County, we typically only see about 3 cases per year, but in 2012, we investigated over 40. And of those, most of those were in September and October. Our investigation found that most of the cases were linked to the schools. The majority of those that were sick were students and their families, as well as some staff members. Once we suspected that our whooping cough was being spread at the schools, we worked closely with the school nurse as well as other school district officials to notify parents and keep them up to date on the situation, as well as to let them know ways that they could prevent getting sick, like being up to date on their immunizations. We educated those that were sick in ways that they could prevent spreading the disease, including staying home until their treatment was complete, washing their hands, and using proper cough etiquette. We also worked with our partners in the healthcare community to let them know that there was an increase in whooping cough, and also to encourage them to consider whooping cough as a possible illness in their patients that they're seeing. Overall, I feel like our efforts and those of our partners stopped the spread of whooping cough in our community. I think we all have a better understanding of the seriousness of this disease, and I think we are fortunate that it wasn't more severe than what it turned out to be. And hopefully this experience will help us understand just what impact a disease can make on a community, and we can be more prepared for an outbreak in the future.
In 2012, the economy was still working to recover. To do our part, we made some significant changes to better serve our community. First, we began accepting and billing select health insurance. Many people in our community carry this insurance, which has helped us to serve more individuals and families. Second, we implemented new policies to help reduce costs, one of which has been travel. We have cut back on this expense to only travel if required by contract or grant or for mandatory continuing education. This has allowed us to put more funding into programs and services. 81% of our revenues come from state or federal grants, or contracts and fees for services. Grants and contracts are actively pursued each year in order to alleviate the tax burden placed on our Wasatch County citizens. We are also proud to say that our health department finances are compliant with all federal, state, and local regulations.
We hope the stories shared here have helped you have a better understanding of the health department. In creating healthy communities, it takes the combined effort of stakeholders, members of the community, policymakers, and healthcare professionals to be successful. It is because of these efforts that Wasatch County was ranked in the top 10 healthiest counties in the state and continues to be a safe and healthy place to live. This year we saw over 17,000 clients walk through our doors for services ranging from environmental health permits to clinical services. Wasatch County continues to be one of the fastest growing counties in Utah, with an almost 8% growth rate since 2010. Over 25,000 residents call this beautiful county home. As we look to the future and challenges that lie ahead, here at the Wasatch County Health Department, we look forward to working together to promote and protect the health and safety of the Wasatch community.